Okay, so this is the CapnoStream 20 that will replace the pulse oximeters that you currently have. And we went with these because it's a dual parameter monitor, so you can monitor pulse oximetry just like you always have. It is Nellcore pulse oximetry, but it also has capnography as well. Now, they aren't going to go away from the Alaris pump modules because they have the feature of kicking off the pump, the drug, if the end-tidal increases or if the respiratory rate drops. But these can be used in any other situations. Anybody that might be on just PRN opioid therapy, or anybody that we're concerned about respiratory-wise. So how we utilize these is, first of all, I'm going to turn the power button on just for time purposes because it goes through a warm-up phase, and that's the power button. And then this is the capnography sample line, and you will see orange ones and yellow ones, and the orange ones are short-term, the yellow ones are for long-term. The orange ones will typically last about 3 hours. The yellow ones, what makes them long-term is this little section called Nafion technology. It's a little braided area that wicks out moisture, keeps it from going up into the sample line. That's what terminates the sample line life.
And just for the FYI,
Yep.
Right now we don't have the yellow ones in stock, but
Right.
we are going to be working on getting those in stock, so they'll continue to use the orange ones.
There we go. So that's the difference in them. So these plug into this little lever area right here that swings open. It goes in, and it's just a little right turn, basically just to anchor it is all it is. It's a male lure lock, so it doesn't need to be screwed in very tight. You can hear the pump turn on once you plug it in. This little guy right here, that is just an exhaust port for the sample that goes in, the gas comes out, and then your Nellcore pulse oximetry. So then the main screen that you'll see always comes to this after it calibrates itself and warms up, and it says, should the monitor be prepared for a new patient by clearing the memory? And we'll hit yes, because we're considering myself a new patient. The only time I would hit no is, say I've been on this, you sent me to x-ray, and I've come back and you don't want to get rid of all my memory. You want to stop? Okay. And you don't want to get rid of all my memory or information in there, then you would hit no. So it's not a touch screen. It's 4 buttons down here, and then anything on the screen we access using the dial, which turns and pushes. So I'm going to select yes, and then it says confirm. Then it goes into the monitoring mode. So this is what the main monitoring mode looks like. You'll have your pulse oximetry down here with your pulse rate, and you'll have your end-tidal CO2 number post there with the respiratory rate. You'll have a capnography wave, and that capnography wave is going to be all over the place while I'm wearing this because I'm talking, and I'm going to go into a little bit about the technology regarding that. So we will start off with these hard buttons down here at the bottom. The arrow one, if I press that, it downloads a library of selections of, say we gave medication to the patient, or the patient is doing one of these activities like drinking, coughing, turning, and then we intervened in some way, like we did suctioning, or we gave a nebulizer treatment. So if I want to select one of those, I'm just going to select Versed. I dial around to where you'll notice it turns blue. So I went on Versed, I pressed that, and it turned red, and what that did was it locked in the memory that I just gave Versed at that date and time. So then the home button down here lights up. I press home, and I go back into the monitoring mode. This button here with the little man on it, I press that. I can enter in an MR number, and I can also change my patient type. It defaults to adult, but I can also select 3 different pediatric levels all the way down to neonate. So I'll go back to the home. This button here with the circle and it says CO2 on it, when I press that you can hear the pump shut off, and this is built for our intubated patients. So if we want to do a suction or a lavage and we don't want the fluids to flow up the line, it pauses the pump and allows us to do that. It also has a timer on there that starts at 15 minutes, and at the end of 15 minutes it'll kick the pump back on. So say it only took me a minute, I'll press that button again and it goes back into the monitoring mode. That button's also nice if you have a patient with just a nasal cannula and they just need to get up and go to the bathroom. I can pause it, take this off, and gives me time to do that. And then the fourth button with the bell on it, if it is alarming for any reason, I can press that and it will give me a 2-minute alarm pause. So now I'll address the buttons that are on the screen, and I'm going to start all the way down here to the bottom right, this little speaker icon. That's my alarm volume. I can turn it up and down. It'll go down to 1 bar. FDA says that we can't shut it completely off, so we have to have an alarm. If I press it again, that little icon turns into a heart, and it's a pulse tone. That one I can shut completely off, but down in OR we like to hear heartbeats during the procedure, so that's why we built that one. Up on the floor it probably drive your patients crazy, so we can shut that one completely off. Now I'm going to go all the way to the left. It's the trend button. If I had this on for a while, this doesn't have much information on it because I just put it on, but if I had this on for a couple hours, you would see a graphical representation of each one of the parameters going across the screen. And this is nice because, say 15 minutes ago your patient coded and the intensivist comes in and says, hey, what happened just prior to that? I can go over here to this button that says scroll, and then I press that, and this cursor line down the middle, you can see it move just a little bit for the little bit of information that I have. It will literally, I can dial it back second by second, and it will show each parameter what was going on. So I can dial back to that code and see exactly what that patient was doing. Back to home. System, that's really for biomed. Patient type, this does the same thing as this button does. If I go to that, you'll notice up at the top here it says adult, and I can change it to all my different pediatric levels, but I'll keep it on adult. Alarms. Alarms, if I press that, it shows my upper and lower limits for all of my parameters. Say I've got a patient that's alarming like crazy and I want to adjust these just to tailor it to that patient. It's already on alarm limits. So I press that again and it goes into this screen, and I can dial around to any of these that I want to change. So I'll just say respiratory low. Right now it says 5. So I go on it, I press it, it jumps over and lights this number up, and then I can adjust that number. So I'll just go up to 10, press it, and it's locked that new parameter in for that patient. Then I just dial back down here to home. I'm almost done here. And then I said alarms. Reports is, there's a couple features that we'll talk about. IPI is Integrated Pulmonary Index, and what this is an algorithm that we built that takes in consideration the 4 parameters, and it assigns it an index number between 1 and 10. 10 is good, 1 is bad. So as an example, say my heart rate just changes, and it's still within the alarm limit, so it's not going to alarm, but my IPI notices that maybe it changed 20 points. That number will drop to say 8 or 7, and that's an indicator to me as a nurse that something has changed in my patient, and therefore I need to reassess or pull a blood gas or something, some kind of an intervention. So it's another signal to us as nurses that our patient has changed their status. Then you have these 2 down here. It says apneas per hour and ODI. Apneas per hour will tell us how many times in the last hour our patient may have become apneic, which is 10 seconds or longer. And then the ODI is oxygen desaturation index, which if they desaturate it as a result of that apnea, then there will be a number they'll post there. What this is used for is not just for a continuous monitoring of the patient, but it logs in information regarding apneas and desaturations into a report that we can print that will help our doctors justify ordering a sleep study. These are for those patients that are undiagnosed sleep apnea folks. So, and then that's what this last button is reports. If I press that, it downloads all those apneas and desaturation information into this comprehensive report. I can hit print report, and it prints it off on this printer on the side onto a nice report. And that is pretty much it.
Can you go through and show just how to use this just as a pulse ox?
Sure. You can use it just as a pulse ox or just as capnography, and it is literally like this. If I just want pulse oximetry, I unplug it. I don't have to turn anything off regarding capnography. It just knows that if this isn't plugged in, all I'm monitoring is pulse oximetry. The other way around too. If I just want capnography, I would plug this in and I would unplug this cable, and it just knows I'm not doing pulse oximetry. And that's it.
Okay.
It's easy as that.